first off, thank you guys for braving the snowy conditions today coming out. A little intro about me. I'm Monica Ashton. I am the Director of Maternal Mental Health at the Healing Group and specialize in maternal, reproductive, and sexual health. And so that's kind of what the Healing Group is. I'll give you a little bit about that. So I have been in mental health for over 20 years, and I quit counting after 20 because then I realized it felt really good when you're counting up to 20, but then when you hit 20, you're like, oh, and now I'm just going to say 20 plus. So this is a little bit older slide. So it's been the last 10 years specializing in reproductive and maternal mental health. I've gotten postgraduate training at PSI. I've worked with Karen Kleinman, who's kind of the world-renowned guru of perinatal and maternal mental health. And I also do infertility work and have trained with Ali Domar and some of the really awesome top-level professionals in that area. Also working on my fellow in thanatology, which is death studies through ADEC, the Association for Death Education and Counseling, which goes hand in hand with reproductive loss and trauma. And then I'm currently pursuing my ASEX certification, which is, I can't remember the name for the whole acronym, but it's sex therapy, essentially. And that's quite the doozy to go through, but it's a great piece that fits in with this whole realm. So that really essentially is what the Healing Group does. We are a group of specialists. So at the Healing Group, no one there is a generalist, which is a little bit different than most clinics. Most clinics have a really general practice, and we have a very specialized practice. And everyone in that clinic, even if, let's say they're just seeing sex therapy clients, still has to have a baseline of understanding of our three main specialties, which is reproductive, maternal, and sexual health. So it's a very different clinic in the fact that all of our clinicians have postgraduate training in those three areas, and we have continuous ongoing training every year in all of three of those areas, and also supervision, which is huge, because we just believe that you quit growing once you step out of supervision. So we're a little bit of a unique model in Utah. We're the longest standing clinic that has specialized in perinatal mood and anxiety disorders. We have a location here in Salt Lake. We have a location in Park City, and coming soon is Utah County. And we have some others in the works as well. So we also have the longest running PMH group. That group, I believe, has been around for 5 years and has been continuously running and is very well attended. And so we're opening up and branching out to some different groups. We have a group in Salt Lake. We have a group in Park City. We're also going to be opening up a group in...
I'm not familiar with what PMH stands for.
Yes, I will get into that. Thank you. PMH is perinatal mood and anxiety disorders. And so we'll go into some of the context, but thank you for clarifying that because I get into my world of knowing exactly what PMH is, and I realize that not everybody does, so thank you. So longest postpartum depression or anxiety group. And that's in the whole perinatal spectrum. We'll talk about what perinatal means and how that's different from postpartum. Essentially, that's pregnancy, anytime within the pregnancy spectrum and after. And so our group runs for about an hour and a half, and it's once a week here in Salt Lake, it's once a week up in Park City, and then we're also going to be having one in Utah County. We also are going to be starting, and I'm super jazzed and excited about this, we are going to be starting a fathers group. And this fathers group is going to be a little different because most fathers don't want to come to group support. We're going to have some meetings at Wingers or, I don't know, Buffalo Wild Wings, things like that. Just more kind of a social support group. And there's going to be some online attendance as well, some online abilities. So that's a little bit about the Healing Group. And we also offer, well, let me get to my next slide. So we meet with individuals, couples, and families. The three main executive directors were all PSI, which is Postpartum Support International coordinators for the state of Utah. We also have an intern clinic. This is our latest intern, Elisa, and we're excited to have her, and which offers a low-cost option for moms that maybe don't have mental health benefits or their mental health benefits don't cover counseling. so it's a great support for the community. Insurance plans, Blue Cross Blue Shield, EMI, Select Health, Uni Behavioral Health Network, and PHP, which I left off of that. Those are some of the biggest insurance plans that we also have. Again, we cover perinatal mood and anxiety disorders, which is postpartum depression, postpartum anxiety, the things we're going to be talking about today. Fertility, grief and loss, healthy sexuality. We also offer art therapy. We have an art therapist who's fantastic. And we have support groups for postpartum wellness, pregnancy loss, infertility. We have a Brene Brown group for sure. We have faith-based support groups. I'm trying to think of what others. We talked about the fathers group that's coming up. The groups that we have that are no cost are up here, except for, so we have flyers and handouts for these groups if you guys want to take them. The postpartum support group, there's no cost, but registration is required. We just want to make sure we know who's coming and have information, emergency contacts, things like that in case we need that information. We also have a pregnancy loss support group. This group is the first Monday of every month, and it is a fantastic group, as well as an infertility mind-body support group. All three of those are at no cost, but registration is required, as well as the faith. It's a group for faith crisis. Anybody that just wants to process that piece. We're going to talk about terminology. This is really important because it really helps you kind of identify what that whole spectrum is within perinatal mood and anxiety disorders. So prenatal is that pregnancy period. Postnatal and postpartum, we're talking about the first year after a birth or loss. Perinatal covers the whole pregnancy and that first year. And so if you're speaking of a perinatal mood or anxiety disorder, we're speaking about a mental health disorder that shows up within that whole perinatal spectrum. Postpartum depression. So there's two different definitions. There's the definition with those professionals in the world of perinatal mood and anxiety disorders, and then there's the definition that's technically considered perinatal, and then there's the DSM-5, which is kind of the diagnostic piece. And so the DSM-5, you can only call it with a peripartum onset 4 weeks after delivery, which is kind of ridiculous because most of the time it's actually showing up after that period. But I just want everybody to kind of understand that difference. So in the birth world, we actually consider that whole spectrum from 2 years after birth or loss, because oftentimes there can still be hormone fluctuations during that time. A lot of women could be nursing past that point, and so it's just really important to understand that we still kind of have that lens of perinatal for 2 years, even though clinically perinatal ends after a year postpartum. PMH-C. PMH-C is kind of the acronym for that perinatal mood and anxiety disorder, and it's a huge umbrella for a lot of different things. So when I'm talking about PMH-C, I want you to understand that it is definitely a term for the whole spectrum of disorders that can happen within that time period. So we're talking about some of these diagnoses that we'll get more into. It is the number one complication in childbirth. And that is astounding. We always are talking about all these other things when you're pregnant. You know, make sure you're doing this, or let's check for gestational diabetes. But the actual number one complication from childbirth is having a perinatal mood or anxiety disorder. 10% of moms that adopt experience a perinatal mood and anxiety disorder. This is not just if you physically give birth. This is also showing up for this major transition of transitioning to parenthood. And this can be child number 1 or child number 5. There's no, it doesn't discriminate. Most moms that I have come in will say, but I don't feel depressed. I can get out of bed, I'm functioning, I'm taking care of baby, And I have this picture of depression as, you know, me just laying in bed and not functioning. And so sometimes that educational piece is, it doesn't look like what most people think depression looks like. So oftentimes this is what providers will say, well, it's just the baby blues, give it some time. And then you have a mom that's severely depressed. It's different. That's what I have a lot of providers say. Well, if I know how to treat anxiety, I know how to treat depression, then why is it different with perinatal mood and anxiety disorders? And there's so many differences with a perinatal mood and anxiety disorder from what traditional depression might show up as. And that's one of the things that we'll kind of talk about, those differences. And it's also because she is being hormonally compromised, sleep deprived, and has a ton of demands happening when you're a new mom. And, you know, it's just a different energy. And there's also an infant that is a huge part of this equation. And so it's very important that these women are getting care from someone that has some additional training for perinatal mood and anxiety disorders. Because oftentimes, I can't tell you, especially if somebody comes from another provider, they're like, they were well-meaning, but sitting and talk about my relationship with my mom is not helping me. I need some help. And so what somebody might do for just a chronic depression is not going to be best practice for a mom that is in desperate need. Okay, also baby's well-being. We talk about brain development during that time, attachment. The lived experience of the baby is affecting their brain, cultural expectations. This is huge. This is such a huge piece of what the good mother looks like. And this message that having a baby is the happiest time in my life because I've always wanted to be a mother. And it can be wonderful and it can be awful. And so trying to kind of break down some of those barriers and those cultural messages and help mom to understand that, you know what you're experiencing is very common. And that a lot of wonderful, fantastic mothers have gone through the same experience. Okay, so we talked a little bit about that. There's a greater risk of psychological harm without at least having a minimal background. I know the Utah Maternal Mental Health Collaborative here in Utah has really been trying to do a lot of trainings of at least the very basics of this information so that providers at least have some idea of what to do with clients that are perinatal so that they're not causing more harm. One thing that's really important to know, especially in the crisis world, because I had worked in the emergency department for so many years, you see moms that are misplaced in the wrong place. They're being put in psychiatric inpatient treatment, which is far more damaging to some moms that perhaps have postpartum OCD and don't even belong there. And the provider just doesn't understand. And so it's really important that this information gets out there. And so we'll talk about the fact that this can be a hidden illness. So many moms look fine on the outside and they're hurting so desperately on the inside.